due for one. They all freak out.
No, we probably have to even discuss why that's ridiculous.
All set?
Yep.
Wonderful. Good afternoon. It's 4:30 p.m. on Monday, October 17, 2022. I'd like to call this monthly Board of Health meeting to order. May I have a roll call?
Andrew Kornstrom.
Here.
Kyle Patterson.
Here.
Danielle Chenoweth.
We have a quorum. I would entertain a motion to approve the agenda. So moved. Second, discussion. All those in favor, sign of aye. Aye. Opposed, that carries. Approval of minutes from the September 12, 2022 public hearing. So moved. Second, discussion. Hearing none. All those in favor, sign of aye. 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 Opposed?
Danielle's on her way.
Perfect. Public participation. Is there anybody here that'd like to speak to this body? Seeing none. Correspondence. Old business, we have none. New business, CUPHD's monthly financial report from Treasurer Ron Fields for August of 2022.
Yeah, as of August 2022, we have cash on hand of just under $8 million, and a total fund balance of just over $8.1 million, representing 48% of our budgeted expenditures for the year. We ended the second fiscal year with a surplus of $206,000, annual budget just over $17 million. Our total revenue for the first 2 months was just under $2.7 million, which is $161,000 under the year-to-date budget. Property taxes were over year-to-date budget by $187,000. Usually that's pretty close to being breaking even, but I understand for that 1 month they were put it on an accrual basis, but more of a cash basis. So that'll be corrected the next month. Grants were under year-to-date budget by $296,000. Revenue for the fee-for-service was under by $61,000. Expenditures for the year was $2.5 million, just under, and leaving us at $537,000 under the year-to-date budget. Mainly due to personnel at $300,000, benefits at $140,000. Capital outlay is also under year-to-date budget by a little over $250,000. Big projects that haven't been done yet.
Thank you, Ron. Any questions for Ron? Okay. Credit card statement was in our packet for review. Any questions or concerns? Hearing none. Approval of payment to Board of Health appointees. Ron Fields, I'll combine these. Ron Fields, treasurer, in the amount of $429.96. Check request $48.36. Ruth Wyman, board attorney, for services rendered between July 21st and August 9th for $425. Check request $47.79. And Ruth Wyman, board attorney, for services rendered between August 17th and September 14th for $525. Check request $47.80. So moved. Second, discussion. All those in favor, sign of aye. Aye. Opposed? That carries. Accounts payable invoices to be approved by the Board of Health. Make yourselves comfortable because we have a long list. Approval of check request 4765 for $6,250 to LaSalle County Health Department for startup grant dollars for services related to the FY23 IDPH Minority Health Refugee, Immigrant, and Migrant Capacity Building Program. So moved. Second. Discussion. All those in favor, sign of aye. Aye. Opposed? That carries. Approval of check request 4879 for $13,125 to Community Health Partnership of Illinois for startup grant dollars and services related to the FY23 Arise Health Equity Program. Second, discussion. All those in favor? Aye. Opposed? That motion carries. I'm just looking down my list. I don't have an attorney here, though. Would it be appropriate to combine them, you think?
You're the chair.
I am the chair. I'm going to go ahead and combine all of these into one motion. They all, at least the ones that are relative to the Arise Health Equity Program. So check request 4876 for $13,125 to Avicenna. Check request 4875 for $6,250 to McHenry County. Check request 4874 for $6,250 to Kankakee County. Check request 4886 for $13,125 between between CUPHD and Immigrant Services of Champaign-Urbana. Oh, and excuse me, one more. Check request 4880 for $13,125 for an interagency agreement between CUPHD and the Refugee Center. That is all of the FY23 Arise Health Equity Programs.
So moved.
Second, discussion. It's a new grant, we've never done it before, right? Okay.
There's two of them, right?
Yeah, those are two separate things, but same,
Very similar.
same idea.
We'll consider them the same in this,
Yeah.
for this purpose.
Yeah.
All those in favor, sign of aye.
Aye.
Opposed, that carries. Ratification of check request 4872 for $6,079.68 for a battery backup system for IT from CDW Government of Chicago, Illinois.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Approval of check 4802 for $6,759.17 for influenza vaccinations from GlaxoSmithKline of Philadelphia, PA.
So moved.
Second, discussion. Although, will that cover us for the whole year?
That's the second half of our
Okay.
one, so yes, that's it.
Okay. All those in favor, sign of aye.
Aye.
Opposed, that carries. Approval of check request number 4831 for $7,115.74 for a steamer sterilizer from Patterson Dental.
No relation.
I was just gonna say. Although mine would have been presumptive, I don't know, maybe it is relation.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Check request 4861 for $5,500 for the 2022 Regional Health Plan Coordinator for United Way of Champaign County, Illinois.
So moved.
Second, discussion. All those in favor, sign of aye.
Aye.
That carries. If you could just note in the minutes that Danielle has joined us. Hi, Danielle. Check request 4883 for $1,573. $1,537.50 for consulting work for EMR reconciliation from Royal Accounting of St. Joseph.
So moved.
Second. What is that for?
Well, that's the Mary, that's helping with the account.
Okay, that's the lady. Okay.
Yeah,
got it.
that's
Okay.
a payment to her.
Gotcha. All those in favor, sign of aye.
Aye.
Opposed, that carries. Check request 4884 for $5,512.50 for county consulting work, consulting work for EMR reconciliation from Royal Accounting of St. Joseph.
So moved.
Discussion. All those in favor, sign of aye.
Aye.
Opposed, that carries. Ratification of product schedule agreement between CUPHD and the InfoSoft Group LLC doing business as Circa for job postings through Circa and diversityjobs.com.
So moved.
Second.
Discussion. Is there a cost to this?
Yes, there is. It's about $8,000 annually.
Okay,
The reason that we had to have it ratified is because we were going to be charged 20% more if we didn't have it done before now, so that
Okay.
is coming.
are there any guaranteed results from doing it?
No,
Okay,
no, I wish there were. They wanted us to sign it for a 3-year contract, but we did the one to see what the results will be.
okay,
So hopefully it'll be successful for us.
okay. Any other discussion? All those in favor, sign of aye.
Aye.
Opposed, that carries. Discussion of proposed investments and approval to proceed from Hickory Point Bank, Champaign, Illinois, and INB-NA.
So moved.
Who's gonna lead that discussion?
Well, that is, they have the list, the two different, she does this
Yeah.
every so often, checks on to see what our CD rates are.
Oh, okay, okay.
And so what did we get at Prospect Bank? It's like,
Right now, we've got 0.55%, but they say that on the next renewal, it'll be quite a bit higher.
but we don't know what that might be, but we do have two quotes from other places. And we discussed this today, Before, when Mandy's tried to do this, she's never been able to get anybody to want to take our $1 million or our $500,000 in a CD. But this time, she actually got 2 people to give us quotes, and one is for 3.5 and one is for 3.25 and 3%. So we discussed about it today in leadership meeting, and we decided to do the $1 million for the higher rate and a little bit lower rate, just to keep them so that they will hopefully continue working with us, but only do it for 6 months because it's anticipated that those rates will go up. Does that sound about right? Look at me, I'm paying attention.
A question, I think I've asked this before, but it's been like 4 years, do we have to collateralize our investments? Do our investments need basically, like with township, we have to collateralize our investments, so it greatly limits the interest rate we can get, and it's by law, and I wonder if we have the same situation. We do. So this rate is a collateralized investment with Hickory Line. That's pretty good. Yeah.
It's only because all the interest rates are shooting up, so it's,
Do you need direction from us, or?
Actually, I think the policy gives me the approval to do whatever.
Just
And
FYI.
I just have bought a few, it's been quite a while. Do you guys want me to let you know, or just give you the quarterly updates?
I mean, I like this. I think it's good just to be aware. Do you guys have any issues with that?
I think it's great. It's nice to keep track of.
Yeah, absolutely. Okay, thank you for your work on that. Approval of job form business associate agreement to authorize public health administrator and board of health chair to sign and otherwise authorize the agreement approving contract with job form.
So what that's a long way of saying is that one of the forms needs to have, I'm sorry?
It's for the sealant program.
Yeah.
And so right now we do paper forms, and it's a pretty lengthy form with like a health history, and parents miss a lot of the info on it. So JOT form like requires those fields to be filled out before they can finish it. It's gonna save us time for, providers having to call parents on the back end and fill in information.
And make sure we get all the information.
Yeah.
So I will authorize one of them to sign that.
Yeah.
Each time, instead of me somehow getting in the loop and.
Makes sense. Any discussion on that? Or do we need direction on that then as well? I would say let's entertain a motion.
A motion to approve that.
Yeah. I'd entertain a motion to approve the authorization.
So moved.
Second.
Discussion? All those in favor, sign of aye. Aye. Opposed? That carries. Approval of quote for main parking lot maintenance from 2 bidders, Elite Paving and Seal Coated Indicator for $76,464.35, and A1 Pavement Maintenance of Urbana for $47,414.99.
So moved.
Second. Quick question. So we're looking to hire both of them to do different parts?
That was not my
No.
understanding.
No, this is just to show you, we want to do the A1
Okay.
one.
Okay, so,
We just were only able to get 2 bids. And like I had said earlier, my brother is an asphalt contractor, so I make sure that they don't have any at all dealings with anybody, so that also limits.
so I'll change this motion. Approval of a quote for the main parking lot maintenance
For A1.
from A1 Pavement Maintenance of Urbana for $47,414.99.
So moved.
Second. And I do have a quick question.
Go ahead.
Do we have I'm not speaking well today. In Champaign, they have CDAP. In Urbana, we're trying to establish a similar thing. The county recently created a process as well to provide points and support for minority women-owned businesses and local businesses. Do we have anything like that at Public Health
I don't
that we
think,
use to rank folks?
I don't think so. We're lucky to get bids usually,
Yeah.
so.
We had talked about doing that, but we haven't proceeded with, we were talking about getting the county together and us together and talking about the processes and so forth, but it hasn't materialized, so.
The cities see
The
that.
cities were just with us, you know, kind of.
Well,
on that.
Pretty robust.
So I realize I was not wearing a mask, that's how I. So I know that the county coordinates with CDAP, correct? And you pay for access to their system. And so one of the ways to get additional bids is to do outreach across a list of registered minority-owned and female-owned businesses. So I am happy to move forward with this. I happen to know there's a very affordable black-owned asphalt company, which might be A1, I'm not sure, that I've worked with in another context when we are looking for minority-owned bids. And so I guess I would ask the staff to look at what the county just did, look at the robust system that City of Champaign has set up, and is there a way we could easily kind of piggyback on? I think, remind me, it was $5,000 a year for access. So basically, instead of creating our own system and registration,
If we could just go.
we
in
could
with
just
them.
piggyback, and perhaps the county does more work than the public health side would try to bargain less than $5,000.
Okay.
But basically, see if we could do some kind of annual fee partnership with the city of Champaign to prioritize and move, it's actually a public health issue for us to be able to support local and minority and female-owned businesses. So I would encourage us to go that direction.
Over the years, we've had difficulty getting bids on stuff. I mean, just even getting 3 is usually very challenging for us.
I think that this system will help with that in part because it will allow us to reach out to companies that don't always have robust websites. And the other thing I just want to mention is that when I was on the Housing Authority Board, after hearing for decades from the city that there are no minority-owned businesses to contract with, when I served with the Housing Authority Board, pretty much we contracted with all minority-owned businesses at Housing Authority, and it completely blew apart that argument. So the Housing Authority has a list of folks that they work with regularly on cleaning and all, contracts and whatnot. And so I feel like those are 2 really good resources for us to consider to interweave with our racial equity task force and our racial equity stance that we took as a board. I would really encourage us to look at that piece as well.
Okay, now, I have one quick thing.
Yep.
Did you say that CDAP or whatever?
CDAP, yep.
Did you say it's through the city of Champaign or the county?
City of Champaign, but the county recently purchased access to it for $5,000 a year, and I don't know the mechanics, but I'm sitting next to the person who would.
Okay.
So, so I think it would be good to just circle up around that piece.
All right, so I will.
What does CDAP stand for? Is that?
It's
Community development?
it's Diversity Advancement Program, City of Champaign Diversity Advancement Program. So we could also have a CDAP, which would be Champaign-Urbana Public Health District Diversity Advancement Program.
We can do SUDAP.
SUDAP, yeah. Our SUDAP, and then Urbana will be UDAP. So,
I agree.
So do you know who I would contact there, or just, otherwise I can just reach out?
Oh, I'd be Rachel Joy.
Rachel, that'll be.
yeah, there's a lot of information on their website. I actually stalked their website to find vendors because they do have a list of vendors on their website. And so I use that as township. I really think this and the fact that there's also there's Bible Action Urbana, there's the Black Chamber of Commerce, and now there's the Business Elevator. So the Business Elevator is a program that's supported by Community Foundation and the Independent Media Center to help to support and resource and network minority-owned businesses so that they're in a better position for subcontracts and contracts. And I think one of the things when we have a big, asphalt's a small project, we can get a black-owned business or, we could get bids from minority-owned businesses for that. But for some of the big things like roofing, we can require a certain percentage, like the state does. You can require a certain amount of minority business enterprise, it's MBEs. And most of the big contractors are used to this. They know that the state has certain set-asides and so they have to use subcontractors and pass through dollars to those MBEs when doing business. And really, that's a way to write long history of inequities and resource provision. And, you know, when we spend $100,000, we're spending $100,000 in our community to laborers, you know, so thinking about where that money goes is important from a public health perspective.
Very good. We'll-
Did
we'll
we
look into that.
vote on that motion?
No, I don't think so, I just talked a lot.
Did we approve the A1 payment? We did, okay.
Okay.
I
I don't
feel
think
like
so.
that'd be just.
I guess I got ahead of you, I'm sorry.
That's okay. So we have a motion to approve A1 payment maintenance of Urbana, Illinois. We have a second. We've discussed. All those in favor?
Aye.
Opposed? That carries. Approval of subcontract agreement with CUPHD along with 5 other subcontracted agencies to assist Helena Health of City of Industry, California to participate in the COVID Equity Program Community Revitalization Grant NOFO from July
And that, I somehow dropped the date on.
25th. I assume in 2022.
Yes.
I'd entertain a motion.
Second.
Discussion. All those in favor, sign of aye. Aye. Opposed, that carries. Approval of Clifton Larson Allen proposal to provide professional compensation services as follows. Market price 50 unique jobs at the organization, $20,000. Develop a pay grade structure classification for pay administration, $3,000. Provide communication and education to staff as requested at $300 an hour.
Second.
Could we just summarize what this is exactly?
Sure. The directors and Julie have been talking about probably for the last 4 or 5 months. Our last salary restructure was done in 2003, long time ago. And well, actually it was 2006. So we decided that we don't really have a baseline. We don't know if we are competitive. We're having trouble with recruitments, and so we wanted to see where we're at. So we reached out, tried to get 3 bids, but was only successful in getting the one from Clifton, Larson, and Allen. And that's pretty much what we're going to do from there. And they're going to help us with the campaign to educate our staff on the levels once we get all that information back. So, is the board? Oh, go ahead.
No, I'm sorry. So we're gonna pay $23,000, then if there's any additional training, it's $300 an hour.
$300 an hour, depending on what our needs are, and we haven't lined that out yet. So.
Okay. Any other questions? Hearing none, all those in favor of approving the Clifton Larson Allen proposal, sign of aye. Aye. Opposed? That carries. Comparison of quotes from GFI Digital and Lasers Edge regarding contracts with printer vendors.
Well, where's Jason?
Jason provided a letter
Okay, is it
that's
in
in your packet.
Oh, okay.
And I can summarize it for you that he feels that going with GFI is a better idea. So that's the letter, and he will tell you more in the packet.
So it's, our printers are becoming obsolete, and so we have to get more. We have to change them up, and this is he's looked at them, he's had the different vendors in, and talked about the different ways to do things. I guess these we'll scan to do our copies, because our copies now are counted by entering a code and various things, and this will be done with a badge, and we're gonna change up the printers because we don't print anywhere nearly as much as we used to back in the day, and so we just need different things, and now that our contract's up, we're looking at doing it a different way.
So if I'm reading this correctly, then the motion would be to approve an agreement with GFI that includes a 60-month lease, maintenance, and paper cutting for a total monthly cost of $3,567.15. Does that seem accurate?
That's how I read it in.
That is which one's that? That's the DFI?
Yeah.
That's the one you talked to me most about.
Yeah, like that.
We have a motion. I would entertain a second.
Second, and I have a question.
Go ahead, Danielle.
Just, before you get tied in with GFI, not to rock the boat, but we just went through this ourselves. And we ended up going with a new printing group. We were with GFI and we moved over. We're saving a lot of money. And it's neither of these groups. I'm trying to get the name of the group. The group we have is public because the town board had to vote on it. So I could send you the agreement we have.
Okay.
But we're really happy with this vendor, and we just moving away from GFI saved us a lot of cash. Now, it might be that you're such a big vendor that that's not the case. So, I mean, I'll go ahead and approve this, but
Well, I
you,
don't know
that
if
doesn't.
our other one was really expensive. This one's less than that, but that doesn't mean anything. does it? Yeah, send me that.
We
and
were,
will-
we were stuck in the old printing contract, the same thing for my predecessor, so when we went to a new printer, it just, yeah, it saved us a lot of money. So I will send you our contract. I'll go ahead and approve it, but that doesn't mean you have to spend it. It just means you have approval. You could always, from a staff perspective, look at this other, and then if it does, you know, if you get a better deal, you might want to consider it. So,
Okay.
Any other discussion? We have a motion and a second. All those in favor, sign of aye.
Aye.
Opposed? That carries. Approval of amendment to service agreement with Curve Dental of Provo, Utah for unlimited grow and grow subscription of $200 per month beginning December 1st, 2020.
You skipped one.
Yeah.
Oh, I'm sorry, thank you. Disregard what I just said. Approval of estimate for new freestanding CUPHD sign to replace existing sign from American Dowell Sign Company, Urbana, Illinois. An estimate of cost to install electrical power for the same.
Yeah, so that is to replace that orange electronic sign out front with a sign that is more like, it's almost like an electronic billboard. Has our name on it, it'll have a vendor's name on it, and it'll have this big, like, kind of TV thing that we'll be able to put ads on constantly.
So my motion is now going to be approval of estimate for $42,206.70 to replace the CUPH freestanding sign with work done by American Dowell Sign Company. Jody, if you could just add the costs in the agenda items.
I'm sorry.
That's all right, just so we know, that way we can just flow and I don't have to look for it.
This agenda was
I think there was also an additional, like 13,000 or something for
For
the electric.
electric,
Yeah.
Water's Electric, right?
I don't remember.
I think it was Water's Electric.
Oh my goodness, I really blew that.
So I see the American Dowell.
And then it says, and estimate of cost to install electrical power for the sign.
Okay.
One was
So,
over 13,000, under 14,000.
yeah, I see it now, 13,228. So we'll do two separate motions, I think, for this, just for clarity. So we have a motion to approve an agreement between American Dowell and CUPHD for sign replacement in the amount of $42,206.70. Discussion?
I'm just curious why the electric that's already out there powering that sign isn't good enough, but I don't know, apparently it isn't.
Is that one powered?
Yeah, it's powered.
Yeah, I don't know why that would be. Any other discussion? All those in favor, sign of aye. Aye. Opposed, that carries. I would entertain a motion to approve a proposal between Waters Electric Contracting and CUPHD for electrical work to power the new sign in the amount of $13,228.
So moved.
Second.
Discussion? All those in favor, sign of aye.
Aye.
Opposed? That carries. Approval of amendment to service agreement with Curve Dental of Provo, Utah for unlimited grow and grow subscription of $200 per month beginning December 1st, 2022. Is that Prince?
Give me the moment.
Well, let's take a break.
Yes, time.
We have a second?
Yes.
Okay. Any discussion? All those in favor, sign of aye. Aye. Opposed? That carries. The last item is discussion regarding funding for the City of Champaign Township's proposed low barrier shelter. And I can speak on this. The township reached out to public health, for those that have been following along in the media. They are close to an agreement with See You at Home for the purchase of 70 East Washington, but there is a difference in the appraised price and what See You at Home is selling their property for. That difference is $275,000. So through policy, we're able to go up 10% more than the appraised price for the purchase of a property. So what we're looking for is to bridge that gap. And I reached out to, the township reached out to Julie with the argument that preventing homelessness this winter would in fact prevent a public health emergency or crisis at least. And so our hopes are that that would be able to move forward. So I would, I don't know, Ruth, it's kind of awkward in this.
Well, it's,
I'll abstain from any voting, of course, but
right now it's on the agenda just as a discussion. So
Right.
obviously you can participate in all of that discussion, I think, when it comes to a vote. But it doesn't look like you're asking for a vote right now, but at the next vote, maybe I'll research that issue and talk about it, about where those funds come from and whether it's appropriate for you to be part of that vote or not.
yeah, and then the other question I would have is that does that take a resolution form, or how would that agreement, or an intergovernmental agreement between the city of Champaign and CUPHD?
I would think an intergovernmental agreement would work. And I'm not sure if there have been prior, I mean, certainly there have been prior intergovernmental agreements similar to that, and so we probably use that as a sort of.
Is that template?
Yeah.
Okay. Any questions or any other discussion as it relates to that? Danielle?
Yeah, so I haven't had so it sounds like this is discussion only, not vote this evening in terms of timeline, is that?
Yeah, I mean,
But we might need to do a special meeting on the
Yeah.
study session.
maybe a vote to support, I guess, if that's appropriate, so that we can put together an IGA.
Yeah, or just, motion to send it to study session, with a proposal, or with, something
Okay.
like that.
An action
So-
item.
Yeah, so I think you probably know philosophically I'm supportive. I have some questions for public health, and then I have questions about the logistics of the transfer.
Mhm.
So, public health wise, where does the $200,000 go to? Kind of what's the opportunity cost, or where's it come from?
But it will come out of fund balance,
Okay.
correct?
At this point in time, it would be assuming that we don't spend everything that we've appropriated, so it'll come out of that.
Okay,
It should
we
be
come out of our surplus and our fund balance. It'll come out of an anticipated surplus this budget year?
That's what I would expect at this point. If not, then it'll have to be fund balance.
Okay, and does our budget year end at the end of the calendar year, or, I can't remember, is that end in December or June?
June
30 in June, okay. So, so the mechanics piece is, it really depends, like, in some ways, my support depends on the language of the IGA. So is the money go to See You at Home, or does the money go to City of Champaign Township? And what are the guarantees? That it's a lot of money, so
Sure.
what's the guarantee? Is like, we guarantee that we will open a shelter by X date, it will serve these people, and it will serve them for 2 years. Like, being super specific, and also, like, since if it goes to See You at Home, if it goes to City of Champaign Township, it's actually a little bit more concrete about you will get this money and it will be used for X thing, and we'll know that you're delivering that thing in Y way. I would expect the same if the dollars were going to See You at Home, like very specific. Because my understanding with See You at Home is that, they are receiving an increase in price. They bought it for $900,000, and it sounds like you can go up 10% from $975.
Correct.
So the increment, which makes sense, is that they need money to pay for the transition out of the space, and to make and it sounds like to do programmatic work. And I just have heard a lot of different things from them, and I'm a close partner with CUPHD, but like the numbers of who's served and how it's served and when they're, like, I think they're really in kind of like design development around that. And so if the dollars go to See You at Home, I want to be super specific about what is the expectation. And so this whole thing of like getting the dollars through the purchase price always, that they need for programs always seems strange to me. It's also the case that a lot of this problem is caused by a timing issue. So for example, there's money on the table that will start flowing in February, March with a consolidated pot between the two cities. So in some ways, we're trying to support that pot with these dollars. And I guess, you know, if it's for programmatic work, I guess there's two things. One is the idea that, like, I want to kind of understand the mechanics of how we give the money and what is the specific guarantee and response. That's the short version.
Yeah.
And then the longer version is like, could we leverage these funds and then get them back, or some portion of them back through the pot, is another way to think about it. Or